Hi everyone, today we are going to talk about how to use MRI for arthritis. So our group is me, Howard. So first of all, we are going to talk about the disease arthritis. So this is a disease that causing painful inflammation and stiffness of the joints. And also there is more than 100 types. Most common one is rheumatoid arthritis. So we can see the picture over here is rheumatoid arthritis. We can see that the joint is quite abnormal. All factors leading to arthritis. So first of all is genetic predisposition, and the second one is unhealthy lifestyle like smoking and unhealthy diet. And third is physical activity level. So maybe you run a lot and then you makes your joint not function well. And the last one is sequela by other disease like tuberculosis and disease of nervous system. So these disease can make side effect to lead to arthritis. Now I will pass to Dave to talk about the equipment for the.
Let's talk about the equipment for MRI. And first of all, the most important part here is the magnet, which is an electromagnet. And this electromagnet can work with the gradient coil, which using the electromagnetic induction to produce the current and apply a huge electromagnetic field through the RF coil, which is the radio frequency coil, to the human body. And then we can get an image of the deep human tissue. What kind of nucleus can be used for an MR? And the first thing is the nucleus have to have two properties, which is spin and charge. And the nucleus are made of protons and neutrons, must both have the spin of half, and proton must be charged. And the pairs of spin tend to be cancelled, so only the atom with an odd number of protons or neutrons have spin. And good MR nucleus are hydrogen, carbon, fluorine, sodium. And in these four atoms, the hydrogen atoms are best for MRI because the hydrogen atom is the only major species that in MR sensitive. And hydrogen is the most adopted atom in the body. Most of the hydrogen atoms in the body are in water, which is H2O. And essentially, in nowadays, all the MRI is using the hydrogen image. How do protons interact with the magnetic field? And first is the moving charge particle generates its own little magnetic field, which means such particle will tend to line up with the external magnetic field lines. And the second is the spinning particle with mass has angular momentum. The angular momentum resists attempts to change the spin orientation. Protons in a magnetic field. Spinning protons are like the little magnetic, and without an external magnetic field, they will act different direction, like a little magnet. But when they are experiencing an external magnetic field, they will line up. And in this theory, we can get an image of human tissue using the spinning proton.
Now I'm going to talk about how is it used for arthritis. At the early stage of rheumatoid arthritis, it is hard to be recognized from other types of arthritis in any physical or medical way unless using MRI. There are symptoms like synovitis, bone marrow edema, erosions, and tenosynovitis, which in conclusion is inflammation and joint damage, which all these can be observed through the usage of MRI, even on a small scale at an early. Now, what we can see is the images of the normal people and the patient who have the arthritis. And about this part, we can see the number one is slightly a darker one, and the patient who have arthritis will be much lighter and we look a much sick one. Yes. So through the MRI, we can firstly know whether the person have the arthritis. So what happens next after we having an MRI? After we having an MRI, you will have a follow-up visit with your doctors, and he or she will first review the result of the images. If your doctor sees the telltale features of the arthritis on the MRI, then he or she will review your symptoms and physics exams and medical history and possibly give you a formal diagnosis.
The advantage of using MRI towards arthritis is, first of all, for the treatment, it can help with the high accuracy of diagnosing and identifying the type of arthritis. And the second one is for future planning. It helps with prognosis and remission, which help proceeding to the treatment for further action.
The price of MRI. The price of MRI is much higher than that of the CT because MRI machines cost 40 millions, while CT machines are much cheaper. At the same time, the laser printer integrated with the nuclear magnetic resonance machine also need 5 millions, which makes the price of the nuclear magnetic resonance very high.
Of using MRI, there's two also. First of all, it's high cost to run because it's using a lot of expenditure to use up an MRI machine. And also the second one is high magnetic field. So as mentioned before, actually MRI is using magnetic to help making the scanning. So high magnetic field may probably make disadvantage to human body, like if you get metal inside your body, so it is not good to use a high magnetic field. Production of MRI applied to arthritis. Here comes the conclusion. First of all, comparing with other medical appliances, actually MRI is much advanced that it can help to detect the symptoms of arthritis 2 years earlier, according to some research. But the only disadvantage is expensive and having a high magnetic field, which is not good for human being. Thank you.
Thank you.